duties, I've touched a bit on this. So many practices will start with one person for physician, or if it's a 2-physician practice, sometimes one person to assist both of them, which can be a phlebotomist or nurse, or, the person is really much more important than even the skill set that they have. So when you're thinking about hiring someone, I think having a person who's really a good fit for the practice is by far the most important thing. And they often will help with sort of everything that you're not doing. So front desk duties, triaging calls, rooming patients, drawing blood. And then other practices find doing this themselves is very manageable, especially when starting up, or if they plan to keep the practice small. And I will say I've found it very manageable. I actually love drawing blood. It's one of my favorite things now that I'm doing it. It's very satisfying. But if it just sort of, I think, depends on what you want to do and how big you're planning to grow the practice. You can always start out without someone and then add them later if you're really trying to keep your costs low. I would say just working on hiring the right person, because having to fire someone, from what I've heard, is really hard. And so, I mean, you can do it, but it's just sort of emotionally challenging. So I think starting with the right person if you're going to get someone.